Hi everybody, my name is Margarita Terrassa. I'm one of the partners here at Women's First, and I'm super excited about our new branch that is called Women First Beauty. So we chose to go with Tixel just because of the great results that people have with short recovery. So basically, when we're talking about radio frequency or CO2 lasers, all of those basically are gonna destroy the tissue. The same thing that Tixel would do, which is thermal energy, okay? So it's which energy you choose is basically which procedure you're gonna have. When we're talking about radio frequency, that goes a little bit deeper than the dermis and it goes into like more the fat tissue. Tixel doesn't do that. It actually is more of a resurfacing, so it stays more on the surface. And contrary to CO2, which it stays on the surface too, like Tixel, but it actually ablates the tissue so much that the recovery of CO2 is much, much worse. So we felt like to provide to our patients a quick recovery with great results, Tixel was the best thing. It would actually destroy the tissue in ways that it would actually help build collagen and elastin. So the idea is if you have tissue that there's wrinkles or you have melasma or you have acne scars, what it would do is it will resurface that area. Basically the procedure is recommended that you do 3 series about 4 to 6 weeks apart, and then after that a maintenance of 1 or twice a year depending on your needs for your skin. But what it would do is destroying that tissue, helping the collagen and the elastin build. In the fine lines, then it will make your skin a little bit more smooth. If it's melasma or acne scars, what it would do, it would even out the skin tone. You can actually utilize it for stretch marks along with scars for your C-section or your hysterectomy. It is a combination of Tixel and some medical management, and we're creating some new protocols to come up with that. So the way that it works is like by breaking the tissue that is like the unhealthy tissue, it helps build the new tissue that is collagen and elastin. Tixel actually can work with every skin type. There are some treatments out there with CO2 that you have to be careful with. You don't want to do in the summertime. With Tixel, you actually can do it in the summertime. So that's what we thought. It was a more comprehensive kind of throughout the whole year, and it's comprehensive in terms of like all skin types. So if you're doing retin oils or retin A, we recommend that you don't do it for at least 2 weeks, just because when you're doing those treatments, you're kind of doing the same concept. You're breaking down the tissue to renew new tissue that will be healthier and probably glowier and prettier. So we don't want to overdo it. So we usually tell our patients stop that. We actually partner with Elastin, which is a fantastic skin, medical grade skin products. And then there's one called the Nectar that we recommend our patients to use 2 weeks before their procedure in means of preparing the tissue to kind of like be ready for the procedure and get a better result. So we realized that we're actually seeing our patients from the beginning of their reproductive health when they're asking us about contraception health, then we see them through their adolescence and then pregnancies and then postmenopausal, and realize that skin changes throughout all those stages. And we're the first persons that these women actually have questions about the skin, so we realized why not provide them some solutions to it. And especially with Tixel, you can actually target all those group of patients. You can get Botox or any of the neurotoxins, but I always tell the patients when you're actually about to do any radiofrequency, and this is out there for everybody that loves CO2, or any resurfacing technique, I would recommend that you do the technique, wait a few months, and then do your Botox, because you don't want to destroy tissue that has, chemicals in there so recently that then you don't know how it's going to respond. There is newer data out there that shows that topical estrogen on the areas where we have very thin skin, like the top of our eyelids and the bottom and the top of our hands. If you do topical estrogen, you actually regenerate the tissue much better and have better outcome in terms of the wrinkles and things like that. So Tixel does a great job with that too. So we thought it would be the best. The decrease in the estrogen, especially during menopause, actually causes us to have less elastin, and the collagen itself is not as healthy, you could think of it. So that's why the postmenopausal patients tend to have more wrinkles. So you can actually supplement with collagen or do technology like this to your skin where you're rebuilding the collagen. Basically, the beauty of Tixel is targeted to every age group and every skin type out there. because in the younger patients, usually they're looking for treatments on their skin because of either acne or acne scars or melasma, which is actually where you get blotchiness in your skin that is related to hormonal changes. And this resurfacing can actually help you kind of smooth those scars and those pigment changes. So the beauty of Tixel is that you actually can maybe just target the areas that are being affected. So for our younger patients, for example, let's say I break out just in this area right here and it's bothering me because of the pimples that I have and the scars that is leaving. We can just target that area. You don't have to do the whole face, where we can just target the area of concern and help rebuild the cells to regenerate a little bit better and build a better complexity and smooth complexity. Because it's resurfacing the area, anything that is gonna look either different skin tones or the smoothness of it because of the stretching of the skin or because of the acne, it's gonna kind of resurface that area and build it again and make it smoother and prettier. And then it also, because it's resurfacing the area, some people that don't have that little cobblestone situation going on, they have more the skin discoloration, it evens out that skin color. So it takes out those that have redness on their stretch marks, it should make it much better, and those that have that white, but it's just like, again, indentation, it should make it smoother. So the beauty of Tixel is that the recovery is fairly quickly. So let's say, for example, I am a patient and I'm like, I want this treatment. Basically, we'd say you can have your treatment, you can have it at any point in the calendar year. It's better, of course, if you're not gonna go to Turks and Caicos and go to the sun, because of course, basically we're burning the tissue and then you're just gonna expose yourself to the sun, so I would recommend not doing that. However, in terms of like downtime, I tell my patients, I personally have had 3 treatments, and when I get my treatments, the next day I come to work and see patients. So you feel a little bit of redness and kind of like a bad sunburn, but not that you cannot get out. You can put a little bit of sunscreen and a moisturizer and you can proceed with your daily activities. In terms of like when you will see the effects of it, I tell my patients it's really not until treatment number 3, and then we say 8 to 10 weeks after that. Because think about it, we're destroying the tissue and the tissue needs to rebuild. So for the tissue to look good and rebuild, you gotta give it time. So it's not like a magic thing that's gonna happen the next day and you're gonna be like, oh, I feel so glowy and so perfect. I can say that a week after I got each of my treatments, it does feel the texture of my skin much more smoother. So it does show some glowiness at the beginning, but the good effects are really 8 to 10 weeks down the road. 2 weeks before your treatment, we're gonna want you to do a treatment with nectar by elastin. And what that does, it builds, or it's prepping your skin for what we're gonna do in terms of the treatment, destroying the tissue to build the collagen, okay? We usually recommend 3 treatments that are 4 to 6 weeks apart. And then after those 3 treatments, you will see the effects of what we've been talking about by 8 to 10 weeks after that. And then you'll be super hopefully happy. And then I usually tell the patients you do need a maintenance at least 1 to 2 times a year, depending on the needs of what your skin needs. Some people once a year, it's all they need, but that's kind of what we recommend. When we're talking about skin rejuvenation or changing the texture of your skin, you can use different types of energy. So there's radio frequency, there is thermal energy, which is what we're using here. There's dermaplaning, there's CO2 lasers. All of those are actually gonna basically destroy the tissue. The difference of all of those is at which level you're getting the energy, or you're getting the needles in which part of your skin, and your provider can help you with all of that. But the beauty of Tixel is the quick recovery with the great results, which you're not gonna get with many of the others. The others, and I can say personally, I've done radio frequency, I really cannot go to work the next day. I have to take at least 2 days. And when you're talking about CO2, you really are gonna recover. You're gonna be in your house for about a week or so, depending on the level of burn that they have done. The same thing with peels, chemical peels that people do. So with Tixel, you're not gonna have that downtime.